That's right. It's confusing patients, it's confusing providers equally, and there have been a lot of back and forth between what is the optimal way to screen for prostate cancer. The prostate cancer screening includes a test which is a blood test known as PSA, which stands for prostate specific antigen. The part of screening also includes a digital rectal examination, which is done by the provider. The PSA testing has been the matter of controversy, and there were studies done, randomized study in the US and Europe came back with kind of conflicting data saying that the prostate cancer screening, we are unsure about whether it does any good versus doing more harm. Lately, there was a large study published in September 2017 in Annals of Internal Medicine, which looked at those studies in European and American studies and came up with a recommendation or conclusion that prostate cancer screening with PSA does have an impact, and it does reduces risk about 20-25% over 11 years from prostate cancer related death. So there are two agencies in the US. One is the US PTF, which stands for United States Preventive Task Force, has recommended that for the patients above age 55 and up to 69. So from 55 to 69, they do recommend at least a conversation between the patient and the provider, a discussion over the PSA testing, and whether the individual would like to get that done, because we have to keep in mind the consequences of that test as well. And what we're trying to avoid is overdiagnosis and overtreatment. As I discussed, removing the prostate gland or doing radiation does carry some risk of urinary incontinence, erectile dysfunction, impotence, and things like that. So we really have to be careful. And the similar stance is taken by American Urological Association, and they also do recommend discussion with the provider between the age 55 to 69. And if you're from the high risk group, as I discussed, if African American, if you have family history of prostate cancer as such, then you should opt for screening sooner. So it's between age 40 to 55, so that's where you should start. My personal recommendation would be to go for prostate cancer screening with PSA. Once you are about 45 years of age, at least get a baseline test so we know what your baseline levels are for PSA, and then monitor it every 2 to 4 years. And so that way we can monitor the rise and see how the level goes over the years. Because the prostate cancer are a different, very heterogeneous group of diseases in itself. Some of the prostate cancers are really slow growing, and you may never feel any symptoms. Some are really aggressive type, but unless we screen everybody, we won't know what we are dealing with, whether the prostate cancer we are dealing with is something which we can monitor with surveillance without doing anything versus something which would require aggressive approach.